Hi everyone, my name is Jacqueline Zamora, and this semester the research that I conducted was dealing with Hispanic women and education and health disparities here in America. The title of this presentation is Health Disparities, Education, and Hispanic Women in America, Bridging the Gap. So I'll begin the presentation with a quote. I believe that it resonates very well with the research that I conducted. It's, "You are only as strong as your weakest link." Presently, there are 27.9 million Latinas in the United States, and by 2060, Hispanic women will be making up 25 to 30% of the female population. I believe that in order to progress the nation as a whole, this demographic needs to be tailored in social and health aspects in order to meet their needs. I volunteer at a clinic called Equal Access that caters to the underserved and uninsured population of the Gainesville community. That is how I found an affinity towards this type of research, because not a day goes by that I don't see multiple Hispanic women with low socioeconomic status in need of health care and health literacy, among others. Since there is such a fast, ever-growing demographic of Hispanic women in the United States, the gap within the lack of physician, public health officials, and policymakers keeps growing in order to care for these women. This brings to light the evident distribution of health disparities, and I believe in order to combat this inequality and health illiteracy, education is key. Education is critical to social and economic development and has an overwhelming impact on population health. Some of the main impacts done by education on health is through the ability of obtaining economic resources such as wealth and social resources such as access to social networks and support. This brings my research question. How does education affect health and social disparities among young Hispanic females in America? So the methods that I used to conduct my research were basically gather empirical evidence that links education with population health and social disparities of Latina women, with the aim of identifying implications for health disparities research. I did a literature search through PubMed databases that ranged within the dates of late 1980s to this year, actually. And I searched the terms education, socioeconomic status, Latinas, Hispanic women, and health disparities. I used a lot of statistics from the U.S. Census, and about 34 articles had relevance toward the research that I was conducting, and 12 articles really met the criteria that I wanted and needed. So we'll begin with Latinas and Education. Education is the absolute foundation upon which other aspects of personal and economic well-being are built. People with more education generally have better jobs that pay more, that include also benefits such as health insurance and retirement plans. People with better education have a better likelihood to live in a better neighborhood that has the access to better schools, that prepares their children in order for them to move on to college and have a good career. People who are more educated have a less frequency to indulge in negative health behaviors like smoking, and also have better access to nutritional choices that lead to better health outcome and less chronic diseases. So Latina women actually are the least likely to attain a college degree. And since I'm graduating this weekend, I find myself to be one of the lucky few. Only 19% of Latina women will earn a bachelor's degree. And that being said, only 17% of the bachelor's degrees given in 2010 were in the STEM fields. That is including science, technology, engineering, and math. That's compared to 20% of black women, 23% of white women, and 33% of Asian women. So to improve educational outcomes for Latinas, there needs to be policies made to provide better healthcare and childcare, so Latinas can have better teachers and counselors that will be able to communicate effectively with their parents. That means destroying the language barrier, giving Latinas better access to rigorous academic programs, specifically in the STEM areas, and allowing them to move between their bilingualism in order to use that as an asset. So, Latinas in the labor force. Out of every $1 made by a non-Hispanic white male, a Latina woman earns about 56 cents. This is data from the United States Census from 2010. 50% of children from single Latina moms live under the poverty line. This is another issue that can be used to promote policies in order to help these women to succeed better in life. Another interesting fact is that about 37% of physicians are of the female gender. Only 7.5% are Latina women. This is alarming because if this population is booming so much, who is going to take care of them, especially if they don't speak their language? There was a really interesting research article that I found that so much can get lost within translation during healthcare. For example, translating in someone who is Puerto Rican that has a translator who is probably from Mexican origin, there are different terms for different diseases and symptoms that it can get very lost, and the more people that there is to accommodate for this language barrier, the more there is the need for this kind of profession. Therefore, I think 7.5% is quite alarming and something that needs to be worked on. 37% of Latinas were uninsured, and that is in comparison to 14% of white women. That was in 2011. And on another note, 74% of women in 1998 had prenatal care, and that was Latina women, compared to 88% of white non-Hispanic women who were able to have access to prenatal health care. This graph, or better yet, chart, has a significant, it actually shows a significant light on socioeconomic status. It shows that socioeconomic status is at the root of healthcare, whether it's shown in an individual-based, community-based, or hospital-based perspective. It shows that socioeconomic status will determine the quantity of healthcare that a person will receive. This image is by Graciela Soto's article, Healthcare Disparities in Critical Illness, and although this is done specifically for critical illness, it doesn't dissuade from the fact that socioeconomic status is at the root of a person's quality of healthcare. On that note, I will end my presentation with the hope that the findings that I acquired will implicate that this information can be better used for practice settings, whether it's with physicians, social workers, policymakers, or even with further research to integrate a better plan that collaborates not only with those professions, but also with public health research in order to increase health literacy with the Latina women community and the public health awareness needed for the Latina women in order for this large demographic of people. Let me remind you that by 2060, 25 to 30% of the US population will be Latina women. Therefore, the influence of public health awareness within the Latina population and the role of healthcare, these findings can be interpreted to propose better policies, public health programs, social services, research, and education to cater to this community in order to progress the nation as a whole. Thank you for your time, and I hope everybody has a good rest of the semester.